Another episode of Empowering Dementia Caregivers podcast. Alzheimer's disease and dementia, what is the difference? Risa Carlton here, your host, physical therapist, and certified dementia practitioner. Believe it or not, it took me the first few years in my healthcare career to differentiate dementia and Alzheimer's disease. I graduated in physical therapy school and started my physical therapy career in the 2000s. Back then, as healthcare professionals, we used the terms Alzheimer's disease and dementia interchangeably. We say it's memory loss, they are the same. With the increasing importance of Alzheimer's and dementia awareness and education these days, we learn and now we have more understanding of these two terms. So what's the difference? Dementia is a symptom. Alzheimer's disease is a diagnosis. Let's take an example of a medical condition to differentiate diagnosis and symptom. Diabetes, for example. Diabetes is a diagnosis, the disease. The symptoms of diabetes are high sugar level in the blood, numbness and loss of feeling in the hands and feet, wound that is not healing because of poor blood circulation and high sugar level in the blood. Alzheimer's disease is the diagnosis. Dementia is the symptom. Dementia symptoms are the early signs that I shared to you in the last episode. The memory loss, getting confused with time and place, changes in mood and behavior that are progressively worsening. Sometimes the doctors use the term dementia as a diagnosis for memory loss until a definitive diagnosis is determined. There is no one specific testing to determine if a person has Alzheimer's disease. It's a combination of testings: neurological exam, brain imaging, mental test, and other type of testings are used to make a diagnosis of Alzheimer's disease or other type of dementia. There are different types of dementia. Alzheimer's disease is the most common type of dementia. In Alzheimer's disease, the brain shrinks because the brain cells are dying, resulting to progressive memory loss. Vascular dementia is the second common type of dementia. This is common to people who had a stroke. With a stroke, the blood vessels in the brain are blocked and the brain cells die, causing the dementia symptoms. Lewy body dementia is the third most common type of dementia. It presents the Parkinson's disease symptoms of rigid muscles, slow movement, and tremors or shaking. To differentiate Lewy body dementia from Parkinson's disease is the onset of progressive memory loss. In Lewy body dementia, the progressive memory loss is the hallmark sign. It is the early sign, and as the disease progresses, the person experiences the rigid muscles, slow movement, and tremors. Where in Parkinson's disease, the symptoms of rigid muscles, slow movement, and tremors are the early signs, and then the person experiences the memory loss in the later stage. Another type of dementia is the frontotemporal dementia. This is common to people under 60 years of age, primarily affecting the frontal and the temporal lobes of the brain, which are responsible for decision making, behavior, and problem solving. Pick's disease is a rare type of frontotemporal dementia. It only affects the frontal lobe of the brain, which is responsible for decision making, communication, and problem solving. I had a client with Pick's disease. She lived in her daughter's home. Since the brain affected is the frontal lobe, she had the hardest time to retain the information and follow instructions from me in a matter of seconds during my physical therapy visit. When I instructed her to walk with the walker to the dining room from sitting in a sofa in the living room, she didn't move and she was just staring at me. An indication that she could not process and follow my instructions. So I had to break down the instructions step by step by instructing her to stand, grab the walker, walk, and pointing to the dining room area so she is able to perform and complete the activity I was instructing her. Creutzfeldt-Jakob disease is another type of dementia. This is common in people over 50 years of age. It is an infection that leads to dementia due to contact with contaminated tissue, such as during transplant or eating contaminated meat. Alzheimer's disease, vascular dementia, Lewy body dementia, Parkinson's disease dementia, frontotemporal dementia, and the Creutzfeldt-Jakob disease are considered irreversible type of dementia. The dementia symptoms are irreversible and the symptoms progressively worsen. There are also types of dementia that are reversible. So they call them reversible type of dementia or temporary dementia. When the causing factor is addressed and treated with temporary dementia, then the dementia symptoms resolve. Reversible types of dementia can happen to a person with brain tumor. The growing tumor interferes with the normal functioning of the brain. Dehydration can cause temporary delirium and confusion. Infection. UTI is very common in the elderly population and can cause temporary dementia symptoms. I have a list here so I don't miss mentioning the reversible types of dementia. Also, after a surgery, the anesthesia can trigger a temporary state of memory loss, depression, side effects of medications is also common to the elderly population because they take a lot of medications. And this is also the trigger for me with my experience of temporary dementia symptoms. It can also happen with malnutrition, substance abuse, exposure to toxic agents, head trauma, and sleep disorders. We miss our sleep from time to time, and that's okay. But when it's becoming habitual and frequent, sleep deprivation can trigger temporary dementia symptoms. Sleep is very essential to brain health. The brain needs to rest during our sleeping hours to reboot, recover, and repair so it works and functions efficiently for the next day. As an evaluating physical therapist, I work with the clients that are right after discharge from the hospital. So my rule in my clinical practice is it is typical for the clients to present temporary dementia symptoms after surgery, after being treated from UTI or other infection, and the other conditions that I just mentioned. Family or caregiver gets worried and get concerned about these new symptoms. So I educate them about this temporary dementia symptoms trigger and educate them and coach them to give it time. The temporary dementia will recover and will resolve in time, usually after a week or so. I see that with my clients. Monitoring of these temporary dementia symptoms is important. When these symptoms are not clearing up or not resolved in a reasonable recovery time, then as a physical therapist, I do a mental test and I refer my client to the primary doctor to do further medical exam and testing. Thank you for watching this episode. Please like and subscribe my channel so you receive the upcoming episodes. My podcast is all about Alzheimer's and dementia, caregiving on, your loved one with Alzheimer's and dementia. We talk about brain health and dementia prevention. Be empowered dementia caregivers. We got this. Till next time.